Assalamualaikum, everybody. This is Active Living Program by MDI. My name is Dr. Zahid Rafiq. Today's topic is Know Your Spine. As you know, in Canada, we have an active lifestyle. Some winter time, especially shoveling snows and things, there can be lots of issues with that. In general, our Canadian population, they're very hardworking people, labor class also. They do lots of heavy lifting in the industries and warehouses. They got lots of injuries. We have today's speaker is Ramesh Bimagani. He's a physiotherapist. He has 3 locations in Calgary by the name of Genesis Group of Physiotherapists. He's also director of Genesis Physiotherapy. We are very happy to have him today with us. He's going to go through today's topic, which is Know Your Spine. He's gonna let us know about the spine and then gonna go through some exercises. I'll request you guys to, if you have any question, you can write at the bottom Q&A session, you can write your questions or raise your hands. Instead of going to the chat box, just go to Q&A. And at the end of the session, we can address your questions. And Ramesh will be happy to answer those questions. Ramesh, over to you, please. You can please carry on from here.
Hello, everybody. Hope everybody can hear me. My name is Ramesh Bimagani. I'm a physiotherapist, and Dr. Rafiq has already given a lot of my introduction, so probably I'll not waste too much time giving like a whole list of introduction up here. So yeah, let me just introduce you to my colleague here, out here, and we have a Mike here, so he's going to help us as well. Yeah, so today's topic, as discussed, is Know Your Spine. So basically, the reason why I said like Know Your Spine is like, so we're going to kind of just have a bit of a knowledge about how the spine works, the anatomy of the spine, you know, the structures that are most commonly, the troublemakers, what we call the troublemakers, and where the pain is kind of just coming out from, and those kind of things. And some simple exercises that we could kind of just focus on a day-to-day to kind of just help loosen the stiff muscles or just mobilize your joints and healthy spine, what we call it. But very importantly, today I'll be also focusing on something called as a neurodynamics. Basically what that means is we're kind of just the forgotten part of the nerves that are not being stretched, that's not been glided or slided, you know, so where they have these barriers that are kind of just holding them back, and they could be kind of just most causative for the pain, you know, so pain factor. So we're trying to kind of just, you know, throw some light on this neurodynamics a bit, so that pretty much kind of just covers everything. We'll try to do our best to kind of just cover whatever we can in this 1 hour session, but probably, yes, anything, your doubts, and for sure you can kind of just, we'll leave it to the end over there, okay? So let me kind of just, hey, kind of just carry so that it's easy to get. Yeah. So I'm not sure like how many of you can really kind of just, my colleague will be helping me out. So let's talk about the spine itself, like, you know, so I'm sure everybody knows the curves and the importance of the curve site in there. The thoracic spine, mainly why it's kind of just hunched up in there to kind of just accommodate all, so the most vital structures right in there. So that's the reason why. And a lot of times this is where like more sort of hunching from the thoracic spine and the troublemaker, what we call it, okay? But at the same time, this structure is also, especially the thoracic spine, is very well stabilized. The reason for very good stability is because of the ribs, and if you kind of just see the connections, you know, so that kind of makes this portion really a stable, spine, thoracic spine of the entire spine area. And of course, the neck, the cervical, thoracic, then the lumbar and the sacrum part. Okay, so I'm not going to go in every structure in very detail because it's going to take away a lot of my time in there. Okay, so first let's talk about, you know, we're sure a lot of people, they're kind of just aware of, they're pretty have good knowledge of this anatomy of the spine with what we call this vertebrae, the spinous process at the back. Most important we need to learn about is just the facet joints. Okay, so these are the joints, intervertebral joints between the 2 vertebrae, the facet joints, And then, of course, we do have the intervertebral, the disc. The disc is basically the shock absorbing structure between the two bones to kind of just give or take the axial loading stress of the spine. The other structures that I want to kind of just discuss more today would be the nervous system. So where the nerves are kind of just emerging between the space between the vertebrae or the two bones up in here and the spine up in there. Okay. So, and of course, on top of it, yes, we have all the muscles right in here. They kind of just cover the entire spine, the front and the side and the back. Okay. So when we talk about the muscles, there are two groups of muscles that we have to always kind of just keep in mind. I know a lot of times we are only talking about just the movers, like the superficial muscles, but the other muscles, the key muscles, what we call them as the stabilizers of the spine, that are the deep muscles. Okay, so a lot of times those muscles are kind of just forgotten as well, and we are always kind of just stretching and working on the superficial muscles. As long as we don't target this, uh, deep muscles that are making the spine going to more and more stiffness. So always there's kind of just, this can remain as a troublemakers. Okay, so probably down the road in other classes that we could kind of just, really talk more about how to stretch or how to work on all these deep muscles and the superficial muscles. And I'm sure previous classes, like, so my colleagues have also kind of just, did discuss a bit about the stretching part and, how it moves and how it works, how to release all the stiff muscles and those kind of things. Okay. So as I said, like, so I'll be kind of just throwing a light on, like, some important exercise that I usually use in my day-to-day on my patients, and I've seen a good results. So I'm trying to kind of just teach everybody those important exercises that could be done on a regular basis to kind of just keep your spine very happy. So that's a program. So let's get started with some exercises, so that's the key part. I know I'm sure everybody, are waiting for that exercises that could be done at your workplace, at your home, at your free or leisure time, so those kind of exercises. Okay, right on. So let's get started here. So Zubila is here. She's going to help me out. So Zubila, can you just hop onto that please? So let me know if I'm too fast. I know sometimes I kind of just go too fast, so I'm just trying to kind of just go quick so that I can just cover maximum. Yeah, I believe everybody can see Zubila here, or I can just, yeah, great. So let's get started with some exercises from the neck. So the first exercise that we're going to do, starting from the neck, we're going to loosen up the facet joints that are going to talk about, okay? So, and very important is like all these exercises that I'm going to show today are just a general basic exercises, okay? If anybody has any particular problem or issues or any of these exercises going to kind of just make your pain worse, you should always stop and always kind of just contact your physician or the physiotherapist closer to you to kind of just go over, hey, is this, the exercise is kind of just good for me, or is it the right exercise for me to? So I'm actually kind of just doing like a general exercise program. Okay? So once again, as we said, like, so we're talking about the facet joints, just simple glide of these facet joints, okay? So that is, we do think everybody can see that. So it's a very simple, just a gentle neck rotation, and we are kind of just nodding and we're just. Right. So yeah, we will move on to the next exercise. This is one of my favorite exercises. We call it as deep neck flexor strengthening program. So as I said, once again, the superficial muscles and the deep muscles. So as long as these deep muscles are not activated or taken care of, we get to have these problems ongoing up in there. Okay? So these DNF exercises are really important for everybody, day to day, everybody is kind of just busy with the computers, spending most of their time with the computers and kind of just forgetting posture of your right straight spine, and then always kind of slouching and hunching, and then just making a lot of imbalances up there in your neck. So there are two ways of doing it. One is you can always get started with a very simple exercise, what we call as a chin tuck exercise. So chin tucks are basically like this. I've seen a lot of people, they like to hold their shoulders tight, hold their neck tight, and then kind of stress themselves. No, no to that. Just relax their shoulders, make sure your cervical or the neck is kind of just well centered, and the neck muscles are totally relaxed. And all you do is a gentle chin tuck. Okay, bringing your chin to the Adam's apple or making a double chin. Just that. Okay, so it's good if we can hold that for 5 seconds and then repeat 5 times, 5 repetitions. Okay, once again, I've seen a lot of people, they're actually kind of doing a neck flexion. No, we're not kind of just talking about neck flexion here. It is all neck is stable, only your head is kind of tilting. So that particular one, okay? And I would like to kind of just sit nice and tall on doing that exercise. That's a very simple exercises we could do at your workplace and things, but if you get a chance, do this other exercise that is really affect you, man. So we're trying to kind of just, we call it as like an all fours or the dog position. And I'm trying to kind of keep the spine straight up in there. So the first component is we're going to do a chin tuck. So a very gentle chin tuck. From the chin tuck, you're going to kind of just roll down your neck. So when you're doing a roll down, you should think like, okay, we have that 7 segments. You're actually kind of flexing each segment at one time, like, so like a roll curve. And you still hold that position. Then you kind of just come back to neutral position. Let go the chin tuck. Repeat again. Chin tuck. Nice neck roll. Neck roll. To the max. You can roll it to the max. And back. So when you are rolling back, make sure you're still holding the chin tuck. That's very important. Okay? So once you kind of just get to neutral position, you can just let go your chin tuck. That's good. Yeah. So let's on to the next exercise here. So it's always good when you kind of just relax there doing a work to kind of just keep your spine nice and tall and then kind of just roll your shoulder blades backwards, So it's nice and tall. That kind of just helps to ease the tension off your shoulders and neck all the time. That kind of just, more tension bearing structures, kind of let them go relax right in there and just kind of just breathe in a few times, relax, calm down, and then just do that. And then probably you can get to your, next work or whatever. Right on. So, okay. So this is once again a very good exercise for thoracic spine people with the postural issues who think they're not able to kind of maintain their posture. So try to kind of just, so learn repeating multiple times. Let me get this closer. Excuse me. But the kind of this here, what I'm going to do is lock behind the head. And what we're going to do is raise the blades. Is that?
Ramesh, we are losing you in between.
Oh, that's because I'm probably moving my computer. Is that because of that? Okay, sorry. When I'm moving the computer, probably it might be losing my voice. But most important is if they can get the video how to do the exercises. I think that's most important. Now we're going to do some mobilization exercises for the thoracic spine. Once again, a good postural exercise. And also we're trying to kind of just loosen up all your thoracic spine by kind of just doing some glides and slides and then movements up in there. So it's the same once again, sitting nice tall, and then you kind of just lock your elbows in this position right in here. So when you're doing that, I know a lot of times people do have some stiffnesses in the shoulder and things. They try to kind of just, get really close and hunch their neck. We'll try to kind of see if you cannot hold your elbows, even if you can get started from here, it's kind of just well and good, okay? And from that position, we're going to do some lateral stretches, basically kind of just bend sideways, left, and then to the right, okay? So you could also kind of just, if needed, you can just hold and feel a good stretch. So we'll get started off from this exercise. Then we'll move on to rotations of the thoracic spine, clockwise and counterclockwise. So get this picture closer. A nice rotation. Good. Right. I know I'll be jumping on really quickly to just make sure I can cover maximum exercises up in here. So hopefully everybody is kind of just trying out these exercises, and they might have already felt like, hey, there's some movement definitely kind of just happening up in that mid and upper spine up in there. Okay, and I'm sure everybody is trying to kind of just correct their posture and trying to sit nice and tall, I believe. That's good. Okay, so we'll kind of just move on to the next exercise. And this is once again a very good mobility exercise. Okay, so this is good mobility exercises for your spine joints, and also kind of just lubricate them really good, and also kind of just, of course, give a nice mobility up in your disc spaces as well. And of course, stretches your muscles and also works the neural tube, or they call it as a neurodynamics. So it's kind of just a helpful for multi-segments of your spine. So I would like to kind of just do a close look at this. Sure, not everybody is very familiar with this. So we'll start off with this exercise first. Okay. Just see that nice, and then kind of just touch down, followed by so this side close. So we're always going to keep in mind, we're going to kind of so pay attention. Yeah. Usually how make sure you keep that happy smile with exercises. Stretching nice. So how's that going so far? Great. So now in the same position, we're going to do another exercise. It's called, oh, somebody said we can't hear Ramesh. Sorry. So I think whenever I'm going a little far away from the microphone and I'm demonstrating the exercises, I think I'm losing voice. Let me see if there's anything that I could do. If I increase the volume, does it make a difference? Sorry. Yeah, can you go into all fours again? So this time, it's going to be more of a rotation movement. Once again, rotation movement. Okay. Nice. So I think everybody got that exercise. I'm sure, yeah, it's recorded. You can go back and then kind of take a look and close look of these exercises. So it takes some time to kind of just, get used to this program and understand, like, so how exactly to do these exercises. Of course, any questions, yes, we are always there to kind of just, you can email me. I believe at the end, I can just provide my email and then followed by my phone number as well. Any questions, doubts, you can always kind of just, reach out to me. I'll be more than happy if I can even kind of just do a really close up video and even kind of just share that too. So we could do that. Okay, so next we will move on to neural tube mobilizations or the neurodynamics that we are just talking about. Okay, so as I said, I'll give you a simple example here, like why I'm stressing so much on this neurodynamics. Okay, let's give me a very simple example. So person coming with elbow pain, always kind of just very straightforward diagnosis. We say like, hey, you have a tennis elbow, lateral epicondylitis, or those kind of things. So we work on the muscle, we work on the joint, you're working on the tendon, you're doing stretches and everything. Every time they're stretching, they feel like, oh, it hurts, it hurts. And you could also, we'll see when we do our resisted or strength testing, we see like, hey, it is weak, so it is your tennis elbow. But we never think about, okay, so the nerve supply to that area, so that could be at fault somewhere. Okay, so that is kind of just shooting up the pain down to that area. So that's a missed component. Okay, so that is the reason why I'm just giving an example. I'm not going to talk too much about this tennis elbow and things. So what we do is, so we're going to add, apart from everything else, we're also going to add some neural stretches and neural mobilizations, or try to kind of see where, if there is any kind of an obstruction, that we could kind of just go release it, and then, glide the nerve, slide or floss the nerve so that it's kind of just moving happily, and then we can get rid of the pain down in there. Okay, and the same concept here we're going to kind of just apply to the spine. Okay, and everybody knows, like all this is where all the nerves that are kind of just coming through the spine and then kind of just apply to every part of your body up in there. So let's get started. And today I'll be discussing more, of course, some of the nerves, common nerves up in your neck, and then we'll kind of just do overall neural tube mobilizations as well. When we talk about the neural tube and of course the spinal fluid, so trying to kind of just mobilize the spinal fluid itself has a lot of benefits too. Okay, so let's get started. So, so once again, lying on your back, or we call it as a supine position. Okay, so can you kind of just bring knee to the chest and then head up position. Okay, and then we're going to kind of just walk like forward and backward movement. See that movement there? So this is a very good exercise for your skeletal structures too. So once again, it's kind of just a nice rolling forward, backward. People who has issues with the lower backs and kind of just issues with the neck that they cannot really hold that position, try to kind of just slow down on this exercise. Position. So usually I recommend my patients to do this. Once they kind of just do the particular exercise, they go into the prayer position, sit nice and tall, okay, and followed by kind of just do really nice trunk rotations. And you hear like, so all those carpeters are what we call the cracks on the spine, and you'll feel great after that. Like, hey, I feel really great, like, energized, and like my spine is kind of really kind of loosened up, Yeah, I can do the rotation. You can always go to your max, so you can go on and then just go to the max. Nice. Thanks, Zuri. So going down to the next exercise, once again, the neural tube mobilizations and neurodynamics. So this particular exercise is really good for people with sciatic pains. The most commonly talked problem in the lower back, we call it as like a sciatic pain. Of course, every pain is not sciatic pain, but still it's okay to kind of just, name it as like a sciatic pain. But this particular exercise is really good for back issues. And then once again, if the problem is something related to your nerves, so it's always good. This okay. So let me move my camera here so that we are kind of just. So I can repeat that few times, like and then move on to
Ramesh, can't hear you at all.
yeah. Or how's the video though? Sorry, how's the video?
It's fine, but it's difficult to hear you.
I don't know if there is a problem with the. I'm sorry. How about now?
Yeah, we can hear you now. When you are
Okay.
next to the computer, it's fine.
I think whenever I'm kind of just moving the camera, that's where the problem is, I guess.
Probably, yeah.
Yeah. Now can you go on to the standing position and then just do that? Okay. Another simple exercise for your back and neck kind of just loosen up the tension in the nerves. And this is simple exercise that's designed that you can do it whenever at your workplace where you don't find a bed, you kind of just jump on and do those exercises. So this is something you can actually kind of just sit and do on your chair as well. But this particular exercise could be done standing. So you can for a few seconds.
Ramesh, sorry, still can't hear even at this time. Like you're next to the computer, but still
Okay.
missing. I'm not sure what happened.
Am I too low? No, I think I'm loud enough. So I'm not sure if it is just the internet or something is kind of just taking a
When
pause.
you come closer, uh, then it's fine. when you move away immediately.
Okay.
Yes.
I'll try to be much louder then.
Sure.
Yeah. Thank you. Yeah. So something similar also on one leg and going back.
Ramesh, do you have a headphone with a long cord? Maybe that will be helpful.
I don't.
It's fine. I
Yeah,
think
yeah.
what you,
I'll try to be louder and then try to be close to the microphone
yeah.
because I know I was trying to kind of just move a little away to kind of just demonstrate in a better way. But I'll
The
try to
other
be closer.
interference is when you're moving the camera, the laptop, it actually, the sound from the laptop carries and your sound cuts down.
Okay. So I'll try to keep the laptop in one place. I'm not going to move it, and I'll try to be louder and closer to. Yeah. Sorry. I think everybody got that particular exercise, I guess, eh? Yeah. Nice. Yeah. Sure. Once again. Excellent. Okay. That's all good. Thank you. So we'll move on to some other nerve flossing exercises for the neck and upper extremity, of course. So we'll get started with the median nerve flossing. Yes. So Shilpa, we're going to get started with the median nerve flossing. Yeah. Try to keep your head neutral, start off. We're going to do a bit of a shoulder depression when we do it, and just stretch the arm out. Extension, and then go there. So if at all you feel any tension when you're doing that, so that means there is definitely a neural tension going down in there. You'll see like a lot of tension, or you'll feel like a tingling, numbness kind of thing shooting down in there. As long as when you do that, that particular position, you don't feel any tingling or tension, then you're all good. But if you feel there is a lot of tension, then I think that's something that you need to get started off, kind of just, flossing your nerve. And once again, when I'm doing this exercise, always nice straight posture and just the shoulder depression, and then I'm going to do that, okay? But now when I'm doing a neural flossing, so I'm going to add another component as you're like, so moving your neck towards and away as well. So that way, we're going to kind of just think like, yes, you have a thread connected from one end to the other end, and then your everything need to kind of just a floss or move the same concept up in here. You can see that to kind of just move ahead, head away and closer. Yeah. And do not try to kind of just do this in an opposite direction. Basically, then you're creating extra tension on the nerve, which you don't want. Okay. So nerves, very sensitive structures. You have to keep in mind, like if it's kind of a hurting to painful, then don't do it because you will end up kind of just hurting more. Okay. Tension is okay, but pain, no. So what we can do is, if at all you're experiencing pain, if you're kind of experiencing pain at the end, you can just back off and see like how you feel there, just a minimal tension, okay? If you're feeling more tension here and pain, then you can just back off. So you don't have to, you can always get started with the shorter range, then go to mid-range, then go to the full range. How is that now? Is it all clear? Yeah, I'm trying to kind of stay close to the microphone. So another nerve we're talking about is the ulnar nerve, so which supplies the inner thigh, your forearm, and then goes down to your pinky finger. So anytime you feel tension down into this finger and then this right in here, then that's kind of just coming from your ulnar nerve. So this is basically, this position itself is more like kind of just a bartender position, like a holding tray up in there. That's how you see in a restaurant how a bartender is kind of holding his tray up in there. Okay. Now, the minute you get into that position, if you feel the tension going down into your pinky finger, so that's an indication, yes, there is a definite tension up in there. Okay. So once again, nice erect position, then kind of just do a gentle depression, and then try to kind of just reach as back as we can. And then, all right. And of course, we can kind of just add that head component. To kind of just, yeah, basically we're trying to kind of just reach it. That's why. Yeah. Okay. So when I do that, I'll go back and I do this. So this is the right technique to do it. We're trying to floss it. Okay. So then the next one, we'll jump on to the radial nerve, going the outer side of your forearm into the thumb. So we call this as a Porter tip position. Porter, they try to kind of just, when you're tipping, you try to kind of just take it this way. So it's called a Porter tip position. Nice depression there. Okay, so that's all good here. So hopefully everybody is kind of just getting those exercises pretty good. So I do have a list of exercises. I'll just go over quickly to make sure I'm just covering most of those exercises that I have that on the list in here. Yeah. Meanwhile, we kind of just go to the next exercise. Let's quickly do what you call static jogging exercise. This is something you can always kind of just, I know everybody is kind of running around, but people who are always kind of just, sitting in front of the computer, they're not kind of just moving much. So what you can do is you kind of just come out of your chair. You can just hold on to the chair, and all you can do is just do a static jog. Okay? So when you're doing this jog, you kind of just look like I'm not really kind of jogging this. All I'm doing is kind of just lifting my heel up and down, and then just there, like, okay, I'm not lifting. Let me just show it again. Make clear here. So I'm not doing this jog, but instead I'm just doing this. I guess you feel energized when you kind of just do that. A really quick warm up, Yeah. So the next one that we're going to kind of just talk about is, once again, a good postural exercise. So when we talk about posture, I think everybody just wants the same thing, is to kind of just stretch out the structures right in here. These muscles need to be stretched out. And then we need to strengthen up these muscles right in here at the back, right here. Okay. So we're going to discuss two exercises for today that are really important or good exercises. Kind of maintain your posture, at the same time strengthening up these muscles right in here. So as I said, once these muscles are stronger, they're not going to kind of just let you punch forward. So it maintains nice erect posture. Let me do a small intro, please. Get a little closer up in here. So this is done against the wall. Legs a little forward up in there, and slightly bend your knee. So we're bending the knee for a reason, to kind of just get nice alignment up in there, and then just roll your belly button up to kind of just engage your core. Very important when you're doing this exercise. I always kind of just make sure, stress my patients, like here, so the spine is straight. There's not much room for the hand to slide in. And this is a self-testing as well. And if you cannot do that, and if you see like it's arching too much and there's a lot of space in there, that means that's the thing that you need to really work on your core muscles. Okay, but anyhow, we'll kind of just move on. And yeah, can you get into that position right in there? So she's maintaining her posture really good, straight up against the wall. Roll the hips, trying to kind of just hold the core up, followed by, do not hold your breath when you're doing this exercise. Elbow 90 degrees up in there, and gently kind of just bring your elbow down. They also call this as a snow angel exercise too. Yeah. So important. Yeah. Just from the 90 degrees, and then just elbows going down. So a lot of times when they're trying to kind of just bring the elbows down, they have difficulties, a stiff spine or issues. What they do is they cannot control or hold the back straight against the wall. Okay, so this is kind of a self-testing for everybody. Kind of just go stand against the wall and see, like, you know, so how far you can actually kind of just put your spine against the wall up in there. Okay. So if you're smiling like Zobi, that means yes, it's a happy spine. Going to do a ball. Okay. Now we can move on to some more exercises here. Most of them are for the spine. I'm sure everybody is kind of just familiar with these exercises. What we call it as a bridging exercise. So we can just do it, you know, on the bed, basically lying in supine or on your back. And we do a simple bridge first. So we'll start off from this bridging exercise right in here. That's a simple form. All you do is you try to kind of just lift your hip off the floor, off the bed, hold for a few seconds, and just drop it down slowly. Okay? So this is the beginning exercise, and we could just advance it to the next level by kind of just using the ball. Very effective exercise. You can see that. And try to kind of just lift your spine up. This is a little tougher exercise. So as I said, see how much you are able to kind of just do that, and then you can just advance accordingly. Now, can we bring the ball to the floor? And you have the ball with you. All your anterior structures, and then also kind of a nice extension of your thoracic spine. People who has lightheadedness or dizziness with all these exercises, please be cautious. Okay, that's it. But I think I pretty much covered for whatever need to be discussed today, and I kind of just leave the remaining session for like any questions or, you know, so we can just go over any of the other things. Yeah, because I know there are a lot of exercises we can kind of just, you know, keep on showing like the entire day, but I'll try to kind of just, you know, keep it short on this course.
Excellent. Thank you, Ramesh, for a wonderful program and exercise and demonstration of spine and some nerves. Our apologies to the participants and attendees regarding the voice quality. There was an issue with when you move away, there was we couldn't hear. But exercises were great. We were able to see the exercises.
Yeah.
So anybody, please, if you have any questions, write on Q&A, or if you can raise your hands, I can allow you to even ask your question. But for now, Ramesh, I have some questions. Like when we announced this session, some people sent some questions. So what do you recommend as daily stretching exercises? Is it should be daily or twice a day, or what's the general consensus?
That's a very good question. Like, so how much of exercises? I know you kind of just learn a lot on the YouTubes and a lot of people showing you everything, like how much of this exercise is like. So I would kind of just keep it at least once a day. So of course, if you have certain problems, then it's a different story, like where you had to kind of just take the advice from your physician or your physiotherapist. But in general, at least if you can just do this exercises like once a day, it is great. Okay, so usually this is the concept. So when you're doing a stretching exercise, I would always like you to kind of just hold the stretch for a good 10 to 15 count or seconds, and then just repeat it 5 times. Okay, so when you're doing the stretching exercise, and a lot of times when you're doing the stretching exercise, be cautious, do not kind of like rock or bounce back. Okay, so always kind of a slow, sustained, nice stretch and hold, and then you kind of just back off and repeat it. When you're doing a general exercise, the repetitions is more important. So either you can start with 1 set of 10 or 2 sets of 10 and progress to 3 sets of 10, or you can do more like so 2 sets of 15 or 3 sets of 15. Okay, so you can start off with once a day and see like how your body is kind of actually liking these exercises, how much you can do, where you can fit in, and then hey, you're enjoying it, everything is good, you have time, then you can just do second time.
Okay, thank you very much, Ramesh. Another question is, um, when is the right time to refer patients to physiotherapists after an acute back injury? Like somebody comes today, supposed to me at the clinic, I had a fall yesterday, or I was shoveling snow, I hurt my back, and it's quite tender, and even he's unable to bend, or SLR is about, say, less than 80, 70. So is that time to refer, or we wait for a few days or week?
Or starting from day one, so basically like what we call it, our management starts with like an acute phase, so we have certain modalities and some techniques that we could kind of just get started off to help the patient from the starting. Okay, so depending on whether he kind of needs a rest, or what kind of rest, or positionings, or what they're supposed to do to kind of just settle down that inflammatory phase with by kind of just using some of this ice packs, or some simple stretches, or simple mobility exercises, or elevations. Could be anything up in there. So, but depend on the condition though, for sure. Okay, so once again, like, hey, when we're kind of a referral coming in, like when they're here, of course we're kind of just running this differential diagnosis to kind of see what are they going to be benefit from what they're going to do it, or is it something again we on our when we do an assessment and the diagnosis, they have to be kind of referred back as well, right? But of course, on the initial assessment, you find out, hey, there's a fracture, there's something really bad, of course, so we won't be able to do that much. So depending on, so what the injury, nature of injuries and what the injury is.
Excellent, thank you. So
Yeah.
there was another thing you touched on, posture. So the presentation, that's, I think, is very, very important. How do you, is there anything for kids, what to tell them right from the small age, how to carry themselves, what posture, what's the importance of posture, and how to have a proper posture?
Very good question. Again, like all we have to do is to kind of just keep them away from the screens, I guess, so, but which is, highly impossible nowadays, so if you kind of just watch them when they're, sitting or reading or something, they're always in a bad shape. And this is the age we always kind of think about, like, hey, how can we really kind of just help these kids, so best thing I believe is to kind of just, play a video. So bring a cartoon character, play a video that's kind of just showing them the good posture techniques. And I believe, poking or pointing at them every time, hey, are you kind of just sitting nice and tall? Are you kind of just keeping your head straight? Probably those techniques will be helpful. But, well, of course, the stretching and exercises can start at the earliest to kind of just, so keep the spine in a good shape, because lately I've been seeing a lot of these kids with, functional scoliosis.
Excellent.
Ramesh, thank you very much, because I
Yes.
can't, put my question into the question box. I
Yeah.
have to ask you verbally. I've noticed a number of kids have a habit of lying down in their beds and doing schoolwork, and they keep that posture for a long time. What is your advice? What complication these kids can get? My question, if you want me to repeat it, I can repeat it. Do you understand what I'm saying?
No, I got it. I got it. But my question is like, when you say like they're lying down, but what position, which position are we talking about? Are they kind of just lying on their tummy, or are they kind of just lying on their back? Lying down is okay. But when I say lying down, if they're on their tummy and then they actually just extended their spine and they're kind of just doing something, so that is good. Basically, what is happening is they're actually kind of just stretching out and extending their spine and then doing something up in there. But at the same time, if they're extending and then kind of just slouching their neck, then you'll see actually if they continue to do that, they will start kind of just developing this really prominent CD junction over there. As long as they're in prone, doing an extension and keeping their head straight, it is good in lying position. So there is, no harm. And if they're on their back, once again, the problem is like, so they're not flat back. They're trying to kind of just, prop up quite a bit with the pillows or something, and then they're kind of just hunching again, okay? So best thing is when they're lying down, if we can manage to kind of just bring the screen up there, or somebody is holding, or they ask them to hold and read, then it's great.
Okay,
If that
thank you.
works. Yeah.
So, Ramesh, there are some questions in Q&A session box. There's one question like regarding any suggestion regarding back fat area stretches, exercises, fat reducing movements for back area.
Okay. So some of these exercises that we did today are good, but at the same time, I'm not an expert into that fat burning kind of thing, but definitely I'm more into kind of just helping people with aches and pains and postures and those kind of things. But when it comes to that, I believe it's always to kind of just a repetitive program, like so a combination of endurance and strengthening. A combination of these two exercises are going to be very beneficial, okay? So when we talk about endurance, it's more like a combination of cardio and strength training, right? And the best exercise, like what I've given to my patients, is like, swimming is a very good exercise, because with the swimming, basically what is happening, it's a combination of your strength and endurance, but at the same time, less impact on your joints when you're trying to kind of just do the workout. So everybody has to kind of really keep in mind when they kind of just quickly start, they're trying to kind of just overdo or stressing the joints and going back to your physicians or physios and, hey, I started exercising and my joints are hurting. So you have to be really cautious, like, so how much you can do and how much your body can take, at least get started somewhere. It's all about it, but doing it in a proper way. As I said, swimming or water pool exercises are really great exercises, less stress on your joints.
Excellent. So another question from the same participant, attendee. If you have early stages of kyphosis, is there some exercises which can prevent further deterioration, worsening? Or are there any devices available, straps or anything, which people can use to prevent these kyphosis from worsening?
No, that's a good question. This is where the problem is, like when we talk about more about the postural issues, that's the kyphosis up in there, There are two things. Of course, if it is a fixed one or a congenital kyphosis, what we call it, okay, of course, there's not much, we physicists can do it, so it has to be roughed out. But what we talk about is the functional scoliosis, like, okay, due to just the kyphosis that you're developing due to your day-to-day activities and your bad posture, bad habits and that kind of things, or what we call it as like, so couch potatoes, so those things. Definitely, yes. Of course, some of these exercises that I kind of just did show you today, if you kind of just go back and then kind of look into the video where I talked more about your thoracic spine, like mobilizations and then extension exercises, they're really good. And we also kind of just touch based a strengthening exercise as well, like what we call as a snow angel. And there's one particular exercise you could also try that is can kind of just show that in on phone. Yeah, scapular retraction. So this is a very good exercise as well. If you kind of just phone, or we kind of just start and see what you're going to do is, so it's called a scapular retraction. So this arm sticks out a bit. One arm at a time. So when
Can't hear Ramesh. Yeah.
how is that now? Can you hear?
Ramesh, can't hear you.
Okay. I think here. So how is that now? Okay.
Yeah, that's better.
Okay. So if you kind of just look at that particular exercise, lying on stomach. Okay. So she's trying to kind of just retract her scapula, or what we call it is she's trying to kind of just pull the shoulder blade down to the mid back. So that's a very good exercise to kind of just avoid your kyphosis. And of course, we worked all your, I've shown you already this thoracic spine exercises or rotations and trying to kind of just lock your hands behind and stretch, kind of just bend backwards. So they're all great. So this is something that you can always kind of just do at your workstation as well. And I know there's so many fancy chairs. They're talking a lot of ergonomic chairs lately. Nowadays can get the chair, ergonomic chairs, but the one that I always recommend is the chair that kind of just supports only till here, so that you always have room nicely to roll your shoulder backwards, okay? And then kind of just do nice thoracic extensions of your spine. So they're always great. Okay, and I do see like a Dr. Rafik's chair over there. Like, yeah, that's not my favorite chair. Sorry.
So, Ramesh,
Yeah.
another question from Malika Valiani. So, question is, one best exercise to control cervical spondylitis?
That's good. So a lot of times, of course, stressing those cervical joints, and so what we call as a repetitive stress, leading to all this arthritic changes and those things up in the joints. So best thing is always like keeping up your nice posture straight up, and then doing nice stretches like side to side bending stretches, trying to do a flexion and extension, and then bending sideways. So this is a very simple exercise that could be done on a daily basis. And of course, we also talked about the chin tucks. The simple chin tucks that we talked about, that offloads the stress on your joints.
Excellent. So next question is from Dr. Sakina Raj. Do you have any red flags or red alerts which can prevent exercises? So one should not do exercises when those signs are there.
Of course, that's why I just did put this in the beginning itself. This is just a general form of exercises, nothing to the specific. But if you have any problem, of course, that's where you kind of just go to see your family physician, or you're kind of going to see your physiotherapist, where on our assessment, if we see or if we pick any of these red flags, then we kind of just ask you to stop any of these exercises, because we need to rule out what exactly is going on up in there, because red flags, the minute you say the red flags, so not safe to proceed at all. But of course, there are so many different red flags that we need to identify which one is that, and then probably refer out accordingly.
Very nice, thank you. So one more question regarding prevention of back injuries, how to prevent them, how to carry things, or if you're doing something heavy lifting you're intending to do, or moving furniture, or moving shift, what is the best posture you recommend?
Well, I know, I'm sure I did not really touch this area just because of the time frame, but there was a question here. For sure, I can just definitely help you with that. Okay. So once again, I think everybody talk about is like when you're actually kind of just bending. So always kind of just make sure before you kind of want to lift something, think twice. Is that weight that you're going to handle or not? Okay. Always kind of just call for help. There's somebody there to kind of just be with you so they can just give you a hand. So always keep that in mind because, once you kind of just get hurt, sometimes it can take really longer depending on what structure that you kind of just injured. Okay, we can definitely kind of just throw some light on this. So this, move my laptop here so you can see better. So let me kind of just demonstrate this. There's a weight there, always kind of just a wider support, wider base, what we call it. Try to kind of just tuck in your tummy. Do not try to kind of just bend here and then try to lift things by keeping your knees straight. I always like to kind of just load your body weight or shift onto your hips and knees. Keep them wide, okay? And then kind of engage your core or hold it tight so that your back is really safe. And then you kind of just, not bending, always try to kind of just bend from hip and knee, grab it, and then lift. Make sure the weight is always kind of just closer to your body, not too far away. Do not try to kind of just reach out and then try to lift. Always keep the weights closer to your body up in there. Okay. And of course, it's the same technique when you're kind of just, lowering down. Is that okay?
No, excellent. Thank you.
Yeah. And I'm sorry that that's a big area that we can really kind of just, talk hours about the ergonomics and so mechanics of how to lift, how to push, pull, and those kind of things.
Thank you, Ramesh. We are almost time is up, but we have one question from Facebook.
Yeah.
This got a question: how to reduce leg pain associated with low back pain? So,
Can you repeat that?
how to reduce leg pain associated with low back pain?
Did you say leg? Sorry, can you type it? I'm not. Yeah.
Pain in the legs. How to reduce your leg pain, which is associated from lower back, coming from lower back.
Oh, okay. So sorry, it's the leg pain. Okay, that's kind of just coming from. Okay, when we talk about the pain, so this is what it is coming from the lower back. So we need to keep in mind like where the problem is stemming from. Okay, so now a lot of times we have this rapid pain going on there. Like first thing is, as we talked about, that's going from the nerves. Okay, so depending on like which segment or which nerve is kind of just involved, so you have the pain pattern going down in there. Okay, so of course, kind of find when we kind of just do an assessment and try to see like what is the barrier, whether that particular nerve is getting pinched right at this segment area or through the course of the nerve due to myofascial structures that is kind of just holding it off. So we need to kind of just do a differential diagnosis and then kind of just work on this. Then definitely yes, you kind of just work where the problem is stemming from, and you can just ease down the pain down into your leg. We can do that. So next thing is like let's we talk about this facet joint pain or intervertebral joints, and this is a common site for arthritis. So when we talk about, people do think a lot about like, okay, it's my disc degeneration is a little different from the arthritic changes that is happening up into your facet joints over here. That's where when they talk about the injections, they kind of just do the facet joint injections right in here. Okay, let's not go in there. So now with the facet joints, okay, so the pain is not just in there localized. Sometimes, yes, you have the pain radiating down into your glutes, or it can kind of just go down into the back of your leg sometimes, right? Okay, so once again, when you're doing your testing, you identify where that the pain is stemming from. And if it's from a facet joint, definitely you kind of just working into that facet area can kind of just ease down, pain going down, traveling down. And the other things is like, when you have the myofascial structures that are the tight bands, or the trigger points, sometimes they could also kind of just do that refer pain down into your legs as well, So once we kind of just work, release this myofascial structure so you can kind of just calm down the pain going down in there, okay? And the other thing that important that we need to kind of just, as we asked about the leg pain, sometimes the leg pain can be kind of just from the pinched nerve, or could be kind of just in a less circulation as well. Because when we kind of just see something, what we call it as a stenosis happening up in there, some of these nerve structures and then your circulation structures are getting compromised or kind of just, pinched, and there's less circulation. And this is where sometimes you see the patients coming to us with a pain when they're kind of standing and walking for a period of time. So they have this pain shooting down into your calf muscles. And the minute they rest, so the pain is gone. They kind of start again, the pain is kind of just coming back. So that is the time that we need to look. And yes, this is more like a claudication pain. So where the circulation structures are involved. So once that's taken care, of course, so the leg pain settles down. So, bunch of these things for sure. So probably I answered your question, yes.
Excellent. Thank you very much, Ramesh. Just a last question, and I'll ask you for one comment, and then we'll end the session. So last question will be, that's from, what do you think of inversion tables? Like considering back pain, inversion tables? Or any comment about that?
No, inversion tables are definitely good. Okay, so if you can kind of just go on an inversion table, once again, inversion tables are kind of just doing a distraction. They're kind of just, doing the distraction and kind of just, reducing the space to kind of just expand and then just allowing good circulation or, whatever that need to happen at the disc area. And of course, it's also kind of just stretching out all the structures of the spine too. Okay, so definitely I would recommend the inversion table, and people with the chronic pains and things, I told my patients you can definitely just try that out. And then I've seen some good responses, but some so mixed responses, but it all depends. So but very important, when you're on the inversion table, you have to make sure you're kind of just not holding the muscles. You have to kind of just let go, and then always it has to be kind of just a gradual tipping. That's very important up in there. But in acute cases, like no, because so you're going to make things worse and you won't be able to hold that position. So I would recommend probably so what we call the subacute, and then into the chronic.
Excellent, thank you.
Yeah.
So last but very important question from all of us, including myself and the family doctors. What do you think, what family doctors are doing better or worse? When are they referring to physiotherapists right on time, or they're delaying it? Or what do you recommend, what they should do?
Well, I think so for it's all great experiences with all the physicians around for sure, so, but sometimes I always feel, there's kind of just the
Honest
diagnostic.
answer, honest answer.
The honest answer, that's the thing, the diagnostic tools, I know a lot of times before they come to see physiotherapists, they already gone through a bunch of these x-rays and ultrasounds, or so they're there for an MRI waiting. And then patients, when they're coming to us hey, my doctor has put me on a list for an MRI. So these patients, their kind of mindset, they're stuck with this MRI. Instead of getting better and working, they're thinking too much about this MRIs. So, sorry, nothing, but I always tell my patients, for me, this investigation is kind of just later on. I want to do my clinical testing. I want to see where the pain is coming from. I know when we kind of just get an ultrasound, X-ray done, there's some arthritic changes that's showing. So now, is this arthritic changes showing on the X-ray is the cause for your problem, for your pain? So we need to kind of just work according to that. Right? So next thing, are you getting done with the ultrasound and things? Some structures are showing hey, so there's a partial tear, minor tear. A lot of people, they do have a degenerative tears happening in the shoulder and things. Okay, but on the clinical testing, when you kind of just do it, it's a different structure that's the causing or the pain that's stemming from, or it could be shoulder problems that's coming from the neck. So you need to kind of do the differential diagnosis. It's a rougher pain coming from the neck. So that's where, so we're trying to kind of spend more time to kind of just, assess. And great, I'm very happy with a lot of, majority of the time, the referrals that are coming to us, a very straightforward diagnosis, but sometimes, yes, it's a misdiagnosis as a general concept, but, that's where we, like to always kind of just reassess assess the patient to see where and what it is. And especially with the other thing is with the MRIs, so with the MRIs for sure, so the clinical setup, what we are trying to do is a clinical, evaluation. So if going for an MRI, I always kind of like, yes, fine, it's great. If you feel better, you can always tell your doctor you don't have to go for an MRI, but let's kind of just work from here to kind of just help make things different. Okay. So I always tell them like, hey, if you don't have this weakness going down into the leg too much, if you don't have this constant numbness and ache and things that is slow, slowly getting progressively better, then you don't have to really think too much about your MRI. Just focus on your treatment, just focus on your exercises, focus on your lifestyle changes. You'll definitely get better up in there.
Excellent. Thank you, Ramesh. Excellent session. So once again, for our audience, Ramesh Bimagani is a physiotherapist, clinical director of Genesis Physiotherapy Group of Clinics, and he has a range of services. Thank you very much for this session. And for our audience, thank you for attending. MDI with active living session, we're planning these kind of sessions every 2 weeks. Ramesh is going to be appearing for us with different topics every month, and there will be another group, Dr. Skina Raj will be doing every month. So that we'll have every 2 weeks these sessions. And you can also suggest us what you want most that we should deal with. So Ramesh can address those things, Dr. Skinner can address those things. So tell your friends, tell your patients. That's very important to have more participation and also more people to benefit from these sessions. I know lots of people join through Facebook, and our Facebook Live is there, and also YouTube channel will have for this recording as well. Thank you very much for everybody for joining us. Thank you, Ramesh, once again for an excellent session. Thank you. Bye for now.
Thank you very much. Yeah, so excuse my kind of just once a while missing out my voice because I was just moving the laptop here and there, but hopefully I kind of just covered. Yeah.
Excellent.
Yeah.
Thank you.
Thanks a lot. Yeah, thanks for listening to my session. Great.